Imagine reliving a scary and painful experience over and over again, but every time you try to tell someone about it, you are offered a trite platitude that makes you feel guilty for being violated. This happens to a large number of women who've been traumatized during childbirth. Around this time last year, Vincent and I were preparing for the birth of our son in June. Due to having medical trauma at the hands of a gynecologist as a child, I had been very leery of the childbirth experience, so I had studied my options and registered us for a comprehensive natural childbirth class that met weekly for 12 weeks. Many scoffed when they heard about our class. Later, when Vincent and I toured the hospital that we'd be delivering our child, it became quickly evident that the other parents-to-be on the tour had not been properly educated about childbirth. Fast forward to late April, early May. Our son was due in June, but the pregnancy became complicated, and it seemed that all my plans for a natural childbirth were going to be replaced by a major abdominal surgery. And then that planned C-section became an emergency C-section. Fortunately, we were blessed with an excellent medical team, and we had prepared ourselves diligently. I attribute this to having had a medical trauma in the past. Many parents, however, do not have this experience. In fact, many parents are traumatized by their birthing experiences. These experiences can have a similar impact as sexual assault. Unfortunately, struggling parents are not validated by others who try to put the focus on the fact that they should, quote unquote, be glad that they have a healthy baby. Today's guest will dispel the idealism of this mentality and hopes to connect with women who need to recover from the scars of traumatic birth.
Hello and welcome. This is Vincent Ketchy, host of Relationship Helpers. Today I have with me Dr. Pauline Dillard. She is the executive director of the Duma Center Ministries, a counselor, an author, and a speaker. She counsels families that are going through childbirth and afterwards. She is a specialist with postpartum depression and post-traumatic stress disorder as well. Welcome to the show, Dr. Dillard.
Thank you. I'm happy to be here.
So tell us a little bit more about your background and your expertise.
Okay, so I actually am a marriage counselor as well. As you said, I have a PhD, and that is in Christian clinical psychology. For about 12 years, I was a childbirth educator and a childbirth assistant. At the time, I lived in California. And then I raised my kids, I went to graduate school, and the Lord told me to go back and specialize in looking at trauma following cesarean sections for the moms and dads in particular, and then also to look at postpartum mood disorders. So that's what my graduate studies were on. And so people do consider me kind of an expert in the post-birth trauma in the U.S., and I call it birth traumatomology syndrome. And I have spoken all over the United States to moms groups and to birthing educators, and now I'm trying to get into the churches and pastors and helping them understand how important this is, because they're seeing a lot of the post-birth mood disorders and they don't know what to do with it.
So you've really studied it in depth, the whole birthing process and afterwards.
Yes. And so a lot of moms are very excited that somebody understands it, not that they're happy to have the trauma. And so from that, I did write a book called Won't Somebody Please Hear Me? I Am Happy I Have a Healthy Baby. It's the rest of it that sucked, because people are always told you should just be happy you have a healthy baby, and it's completely discounting the heart of the mom.
So people really aren't listening to the mom afterwards, or the new mothers.
No, and that was what came out the most frequently when I did do the research, is nobody's hearing me. So it's like, then they're being criticized for being told, well, why can't you just be happy you have a healthy baby? As if they're not happy the baby's healthy.
Right.
But unfortunately, a large percentage of the women are finding out after a cesarean in particular that it wasn't really even necessary. And that's part of what's creating more trauma for them.
So the more surgeries, particularly the cesareans, are causing traumas.
They are. And we have like a 33% cesarean section rate in the United States today. And really maybe 3 to 5% of moms and babies would die without it. So I'm not saying I'm not happy to have that as an option. But a lot of women are manipulated into it for other reasons other than they or the baby would die. And then it's that manipulation and control of their body during the process that brings out the same type of a reaction as a woman who's been through a sexual assault.
So they're out of control of their bodies during the whole process.
Right. And they're being pressured and manipulated into having something done to them that they don't want. And when we birth a baby, it's a highly sexual experience for women, and we don't want to acknowledge that in our culture. I'm not saying God designed sex only for having babies, but it is an apex of who we are as sexual beings. And so then that's being manipulated and controlled. So I do want to just make this statement really quickly, that I'm not saying every woman who has a cesarean has to have trauma. That's not the point. But the point is about 1/3 of those women will, 28 to 30%. And we need to, and that's a significant number when you consider 4 million births a year.
Right.
That's a lot of people.
So there's tons of women that are being traumatized, and they're being discounted after the birth. They're trying to talk to others about their pain or what they're going through, but no one's listening.
Correct. And then the dads are impacted by that as well. We have to remember that they're usually there, and and dads can often be traumatized. When I was doing labor coaching, I sat sometimes in the hallway with those dads when the wives were being taken in for truly emergency cesareans, and the trauma that they were going through, and talking to them, and their wife is in there having something done that they may or may not know if they're getting her back. And it's a very scary time. So if we don't understand and really address that for both the mom and the dad, they start to go into silence mode, even with each other, and it really then impacts the marital relationship.
So it sounds like there's a real lack of knowledge about pregnancy.
Well, it's a weird cycle, Vincent, because back when I was having my kids in the 1980s, there was a huge upswing with the natural birth movement. So a lot of us were very, we're educating ourselves, we know what we need to do. And it was highly educated women who were having home births, who were, doing birth plans. It wasn't just these, uneducated women. It was people with college degrees and all that, because we researched it. And I don't know what happened since then, but then I was out of it, of course, because I was in graduate school and finishing off raising my children with their teenage years. And when I came back into it, there was this cultural mode of women in their 20s not getting it, not researching it, not going after it, and being controlled more by the medical system. And I have to say here, people always go, oh, you hate medicine. No, I don't. But I hate sometimes the control and manipulation that can occur because of insurance, malpractice. It's faster. And so a lot of women in our culture have been convinced that their bodies don't work. But God designed this beautiful thing, and if we really connect with who God is and really listen to Him and really connect with what He wants us to do for our births, with the men as the head of the household, men have to really engage that piece. Then we can know that we're doing what God needs and what He wants for this child's birth, because every birth's going to be different. So it doesn't mean He's never going to tell somebody they need to be at the hospital. It just means, why are you there? Are you there out of fear? Are you there out of ignorance? Are you there out of leading from God?
So there's been this trend of telling mothers, maybe not directly, but maybe indirectly, that their bodies aren't working correctly, that they need this medical assistance.
Correct. And so we have some, even I talk to a lot of people my age, which I'm in my 50s, and my kids are older, and we're having our grandkids, and they're even saying to me, what the heck has happened? Why is it so surgical these days to have a baby? Why are so many moms having troubles? Because, yes, some of our friends or whatever had cesareans when we were having our kids, but it wasn't to the numbers we're seeing today. It wasn't fear-driven to the degree it is today. So to help marriages, actually at Dunamo Center Ministries, we have a branch called Discerning Childbirth, where we do teach the birth education, and we do teach how to care for moms after they have babies and things like that. And the birth class, the very first one, is all about how do dads really engage with God for their wife and child, because His order and authority hasn't changed either. And so a lot of men feel very pushed out of the process, which at the very beginning then of having children, they're being disconnected from their spouse, from their wife. with the whole idea that their main role is to sit in the corner while this almighty birthing goddess woman does her thing. And that's not biblical at all.
Right. So you're talking about part of your education is maybe empowering the husbands a little bit more in the process.
Yes, it actually is very much empowering them for who they are as the spiritual head of their family, the authority they have given by God to really connect with and pray for what is the best for their wife and child, so that their wife can be very well cared for and know what kind of support she has spiritually. So then, of course, I have to work with the wives that he's really wanting the best for you. You really need to, allow God's order to come in. But if they see their husbands embracing it, then they can relax. Because I get that we also have a culture in the United States of women just saying, men aren't going to tell me what to do. And it's permeated the church. So they have to also learn the beauty of God's order for us, because pregnancy and childbirth is an extremely vulnerable time for us.
So this is a time that the husband really can help provide security to that woman that's going through this childbirth, that's going through this unknown process, especially for someone who it's their first birth.
Yes. And so what we do here, and I'll be training more people around the U.S., and we're going to be offering it as an online where people can follow the class online, but I do it as a workshop format. And so a Friday night, all day Saturday, the first part is called Choices for a Discerning Childbirth, which is really going through all this marital order, going through options, pros and cons of prenatal testing, newborn care, that sort of thing, pros and cons of birth settings, care providers, and then how to really connect with Jesus to hear what he wants you to do. Because we have to have some knowledge, or we can't really exercise faith in those areas if we don't have knowledge of the possibility. So that first workshop people can even take before they have a baby or before they're even pregnant, so that they can lay foundation for their marriage. And we talk about having a connected marriage through the entire process. So that's the first part, and that to me is the key to having a really healthy birth, is when we understand foundations, and to having a God-centered, Christ-centered, heart-connected experience.
So listeners, you can find a link to her website and to these seminars at relationshiphelpers.net. There's a show notes page for Dr. Dillard. So make sure you go to that page to go to those links to go to her website. So it sounds like you're really encouraging these marriages to be strong so that they can support this whole process.
God intended, when we look at Malachi, he says that he wants godly children. He wants the marriages to be godly because he wants godly children. So if we're not in right order, we're not going to even have our kids in right order. And then there's going to be more trauma induced because, I do believe we do have a real enemy. I'm not saying he's attacking personally, but yet he's attacked the system of how God designed this thing to work. It's really destroying marriages. A lot of people don't understand that. Vincent, I just wanted to say, when they go to the link for my website, they can find a free download called Dads Be Confident in Childbirth. So it's a little handbook. I do pass that out at when I'm out at conferences and things like that. We do have hard copies, but they can do a PDF download for free at our website, where they get some of the foundation of why the dads are so key to the process. So that's available there.
Okay, so there's lots of free information that you have for families that are expecting.
Yes, we have the download for the dads. There's a download for questions, like if you're interviewing care providers, what questions should you even be asking? Or you go on a hospital tour or something, what questions should you really be asking? And I tell people that you're probably going to be the only person asking questions on the tour because nobody knows what to ask.
So a lot of people aren't asking.
No, they're not asking. They're just like, oh, this is what it is. I just have to do this. And so they listen to the tour for the hospital and it's like, okay, but they don't even know that they can ask questions or should ask questions about the policies, the procedures. What if we want to do it this way? Will it be okay? If I come in and I say, no, I don't want fetal monitoring for 30 minutes, what's going to happen? You know what I mean? So they're not really asking the questions, so they don't know how to really evaluate what that hospital's policies really are. So I've had students have them get mad at them, and I've had students had them be, oh, wow, you're asking some good questions.
Well, my wife and myself just had a baby. Our baby's 5 months old as of now. And we were some of the ones that asked questions. We had done a lot of the research. We had taken classes. We had learned a lot. And you're exactly right. I started asking questions. We had about a dozen families in there. And I'm the one asking questions. Everybody's looking at me. But, what was interesting was the one doing the tour, she really enjoyed that I asked questions. They were excited that I asked questions.
So it varies, some are very excited and some are just like, let me get through my tour. Right. It depends on what their real reason is there. Were they just told to be there, or do they really enjoy the process for the family? So the other free download is called Red Flag Statements, which is, how do I understand what I was just told? In other words, how do I recognize that this is a red flag and I should really be exploring deeper? I tell people, don't challenge the care provider right there, but ask the questions and write down their answers. And then I have some exercises for how to evaluate what are they really telling you. So, for example, if you said, what is your cesarean section rate? And the doctor says, well, I only do them when they're necessary. What did they just tell you?
That they're not so much for them.
Well, you could assume that, but actually they're also saying that they don't want to tell you what their number is.
Oh, maybe that they're hiding it. Okay, yes, maybe.
And so they didn't really tell you anything, because how often do you, doctor, personally think they're necessary? So some doctors think they're necessary 15% of the time, and some think they're necessary 35% of the time. And what's in between there? Now, if I'm looking at two different care providers, I need to understand that number.
You need to know their philosophy.
Yeah. How do they approach it? So there's just questions on nutrition, questions on policies and procedures, questions on newborn care, and then how do we evaluate what information am I really getting? Because some of it is just information. So is it good information or bad information? You have to decide. So that's a free download too. And the other one on the website that's also a free download that I think is an extremely powerful tool is Postpartum Care Handbook. And people can download that. And that's a little handbook that they can fill out how they'd like people to help them after they have the baby. Now, this is then moving towards like what's going on in the postpartum period and the mood disorders. Well, some of it is the birth trauma stuff we just talked about, which I really have a 90-minute presentation I do on fully understanding that. And then I have the book, which is for sale on the website. And a lot of people have gotten the book and been able to walk through healing, because I do have the process for how to heal, how to forgive, how to understand physiologically, emotionally, and spiritually. So that book actually has it all in it. The handbook for postpartum care is to address the isolation piece in our culture, that there's a lot of moms who have postpartum depression because they're so alone, they're so isolated, and they're not well cared for. So this is kind of my new thing that I'm now bringing into churches. And I spoke at a pastor's conference already on it, and I'm speaking to several, because the pastors of the churches need to start to understand that part of what they're seeing is because we, the church, are failing our new moms and dads. So how do we as a church come in and actually care for them at a very rubber meets the road kind of way, to say, I'm just going to serve you as Jesus would have me serve you, because you're important and valuable to us.
So you've been seeing this trend of the church not really caring for these young mothers.
Yes, and we've lost it in our culture because we're so mobile that the young moms really don't even have grandmothers, aunts, sisters there to help them. So then they come to the church, and the church is like, well, we'll bring you meals for 2 weeks, which I don't want to say don't bring meals, but bring the meals. But it's like barely the tip of the iceberg. Mm-hmm. A lot of churches don't understand that new moms and dads are telling me, by the time we got the 4th sesame chicken casserole, we just couldn't even eat it. So, and really what they needed was somebody to come in and do dishes and vacuum the floor and, clean the bathroom. And that's what they really need, because the isolation, the aloneness, and the not really knowing what to do after a baby is creating some more mood disorders. And so then we try to tell the dads, you have to do more. Well, you have a 5-month-old in your house. How much more can you do? Mm-hmm. You know what I mean? I mean, you're doing your job. You're doing your interviews. You've got your counseling practice. And you have to still go do that to provide for the family. And then your wife is tired and she's nursing, and you go to work and she's sitting on the couch in her robe nursing a baby, and you come home and she's sitting on the couch in her robe nursing a baby, and everybody tells you do more. And it's like, but there's no that you can really put in either. So we have to care for new couples. And this is where I really ask that the seniors in the church really understand and embrace that we have a biblical requirement in Titus 2 for men and women to come back and train the younger couples. So if we can take some pressure off of them and come actually into their home and care, we can take some of that pressure off, and now we're just caring, and we can give them that example of how to care for the home and how to care for their husband. The Titus 2 men can come in and help the dads to understand how to be good spiritual leaders and how to be sound. And, go look at it, because I always ask people, have you ever heard the sermon on the Titus 2 man? He's there. So go look at him. He has some requirements for you, to come back and help you when you have kids and are married.
So this is something that's just not talked about in the church, or just not maybe recognized that these young mothers really need this help.
It has not been recognized. And, since I had my children, and my kids are, around 30s, it's even worse than it was when I had my kids. But when I had my child, my closest relative was 2.5 hours away. So I didn't have anybody in town, and the church did nothing. I mean, I'm not joking. They did nothing. We didn't even get the meals. We didn't get anything. Okay. And it was such a startling transition, because you have to adjust to a whole new way of life. And I had nobody I could turn to. And I was a brand new Christian too. So I didn't even have family I could call and ask to pray for me, because they weren't walking with the Lord. So it's like, this is so key. And then as I live in a military area in Colorado Springs. We have a lot of military here. So a lot of in and out, in and out, in and out. And I get these things. I'm 8 months pregnant. My husband just got transferred to, Colorado Springs or whatever fort or air base. I've moved away from all my family and friends. And last week he was deployed, and I don't even have a church I belong to. And I'm really scared. And I had postpartum depression last time. And so where do I send that mom?
Right. So they're very alone.
They're very alone and very isolated, and they're scared of the depression. They're scared of the isolation. They're already isolated in general. So if churches had a ministry that would reach out, regardless of whether people go to your church or not, I'm not saying it's an easy ministry. It's not going to be an easy ministry. It's going to take actually reaching out. But Vincent, what I'm noticing this year is churches are starting to go, there's a problem here generationally in our churches. We're not caring for our generations correctly, and we got to figure this out. Now, it looks new, sounds new when I come in and talk about it, but I've been talking to the church for 30 years. And they're just now opening their doors to the idea that we've missed something here. So we need to figure out what to do to reconnect relevance of the church to our next generation of moms, dads, and marriages.
So it's a really slow process for the church to understand where it's lacking.
Yes, and that's been lacking for at least 30 years. I would say more, like when we started the breakdown of the way our society was in the 50s and 60s, and then there was starting to have that movement away from family and the mobility. That's been the beginning of where we've had this separation. But now we've gone through the culture, and you as a marriage counselor understand, like the breakups and the multiple marriages. And now we have a generation of kids who don't even know what connection looks like, sounds like, feels like, tastes like, so to speak. And they come to the church and they say, you say you're a family, and then we say, I don't have anything to give to you.
So not really meeting the needs of those. So talk to, let's say we've got listeners that have young families that have just had a baby and they are struggling. What would you tell them to help them figure out, or to diagnose, or at least to understand if they really are suffering from some trauma, or that they need some help from a counselor or someone like yourself?
Well, first of all, you have to know them, don't you, to know that. And unfortunately, this is what I get from the young moms. I can't find any mentors. Where are the mentors? And then I get from the older women, they won't listen to anything I have to say. And I have to tell them, because you haven't earned the right to speak into their lives. So they have to build a bridge by actually, going in and meeting with them, or, finding out what's going on in their household, or being there to help them, because it's just through being with people that we earn trust to actually then speak into their lives. So as we're with them, they will start to trust us and start to say things. And sometimes all they need is just somebody there to care. They don't actually need a professional. They just need somebody to care, to say, hey, you're doing a good job there. Or, yeah, I remember when that was so hard, and this is what helped me. And not to make them be a Christian, but to just be with them. And then we are Christians, so that should shine through. And if they ask a question like, well, how did you manage to get through it? Part of that would be, well, my faith really helped me, and this is how. So it's not just an esoteric, oh, just trust Jesus, without really being able to express how. Now, granted, there's going to be a percentage of people that do need professional help. And if you're with them and you see them in their home, you're going to figure that out, that, wait, this person is beyond just isolated depression or a little bit of an adjustment disorder, and they just need some support adjusting to something else. So we know there's that 4 to 5% that moms do go to psychosis. And so if somebody feels like it's beyond just, hey, being with them perks them up and helps them get through the day better, then they do need to find a professional.
Oh, so I was going to ask you, so what is that psychosis? If a husband's trying to figure that out, or others, what do you mean by that?
Sometimes it's hard to see because we're not with them enough. You know what I mean? That's why you got to kind of be in the home. Are they connecting to the baby? Are they making eye contact with the baby? Are they caring for the baby? Are they making statements like, every mom might say, some days I wish I didn't have the baby. I mean, we all say that. It's exhausting. It's overwhelming. I don't want him here today. But when they start saying, either not saying anything, but you see that they're not connected to the baby, their depression is beyond, they're not even engaging the people who are there, or they're getting manic. Sometimes they get really manic before they go to psychosis, and you're wondering what's going on, and they're not coming down off that when you're there with them. Those would be some signs.
Oh, so what is that manic? What does that manic look like?
The manic will be she's probably not sleeping, and it's hard to diagnose that because you have a new baby in the house, you're not sleeping, so there's it's very hard sometimes to evaluate. Is the not sleeping because she's getting up and nursing a baby every 2 hours, or is it because she's manic? And mania would be not sleeping at all, and maybe she starts running around cleaning the house excessively. She's exhausted, and then you start to hear these kind of weird trains of thought because of that. Mm-hmm. And so it's a matter of, can she sleep when the baby's sleeping or not? Through a 24-hour period, if we sleep when the baby sleeps, we'll probably get 8 hours in a 24-hour period. But can we do that? And so the first 8 to 10 weeks, it's hard to know, is it just that she's adjusting to the baby, or is she really in a state? Now, that's where I also then look at, do we have birth trauma attached to it as well? Because women who have natural births have a much lower possibility of this happening. I'm not saying no natural birth ever has it, but again, it's about 4%, whereas with the cesarean moms, it's going to be a lot higher. And or extremely traumatic birthing. I'm not saying only cesareans can be traumatic, but other births can be as well. So is she almost too happy? I don't know how to explain that. Do you know what I mean? Like, she seems sort of like giggly happy, and you're like, well, I'm glad you're enjoying this, but that seems a little odd.
Right, so it's out of character.
Out of character for her. And does she, granted the first, 4 weeks in particular, she might just be too tired for company, or she might just not want to have a lot of people around other than those who are helping. But does that continue where she's isolating from everybody, even her best friend or something? She refuses to talk to them or won't allow them to come over. So that's going beyond the baby blues is really what we're talking about. It's that about the first 8 weeks, a lot of women can have it because we go through this huge physical thing. Our systems are changing. The placenta was doing what the pituitary gland normally does. So now we have a transition phase back to the pituitary gland taking that over. And there can be some, slowness, depression, tired, just emotional things that go with that. We have to look at her nutritional process. And that's why we need to come in and surround that woman and not expect her to do more. See, we have a problem in our culture when it comes to this, Vincent, and that is we expect women to do it all. We expect them to do it all well, and we expect them to do it all alone. And that's just not really what God intended.
Right, so these unrealistic expectations of women.
Yes, we have very high unrealistic. Now we're shifting with our culture going from this, masculine, feminine, just culture, not the church in particular, but things do bleed into the church. That now, okay, so the man should just take that stuff up. And like I said, he's busy. I mean, he's not sleeping. Babies are crying at night, and it just depends on the man. So we're seeing more and more depression in new fathers too. So that's now being studied and evaluated. And I want to put out there that what we do, we being like my generation and up, what we do now is going to impact the next 5 generations. And what kind of legacy are we going to leave? And I'm going to tell you right now, when I talk to the younger moms and dads, we're not leaving a very good legacy for them. They're not real. They don't look at us and want to bless us. They look at us and they want to curse us because where are we and why don't we care the way they need? And it's going to be harder now because these walls are built up, and we're going to have to come in and start breaking those down and say, we do want to care for you in a very real way, in a way that matters and that's relevant. And we are their parents' generation, so their anger may be at their parents not having been there for them. I was a teenager in the 70s, and we were actually called the me generation. So we're kind of the original me generation, and there was just me and what do I want, and there was a lot of selfishness there. And we're now the tightest 2 men and women, and I do still see like, oh no, I already raised my kids, I don't want to go back and do that, and and I'm like, I'm not thinking that God said it was optional, because when I look at that, he's saying this is what you will do.
What has been your biggest stumbling block in your relationship with God?
I was going to say it jokingly, but it's really not a joke. Other people. Learning how to really love other people the way that God wants me to. And so I get really frustrated with, for example, my frustration with people not wanting to do what God has commanded us to do. So I have to reframe, I have to do my own forgiveness so that I can even enter in with the tightest 2 men and women in a more gentle, kind way to show that God is just wanting to direct us when I really want to just bring a hammer down. So that's probably one of my biggest stumbling blocks right now. Yeah.
What is the best advice you have ever received?
Oh, I know there's some. I haven't thought about that for a really long time. I guess I do remember the best advice. It came actually from my mother-in-law, and she probably doesn't even know this. We did not have a really close relationship, but it was when I was pregnant with my first baby. And the doctor kept telling me, you're going to have a really big baby. And I would say, well, is this going to be a problem? And he'd say, no. Well, I knew that my mother-in-law had big babies, and we're talking over 10 pounds, over 11 pounds. So we're not talking lightweight. And she just looked at me and she said, you do what you have to do. And I will honestly say that was one of the best things anybody could have said to me during that time. And so that's kind of carried forward, that I do what I have to do. So even when God leads me into something I don't want to do, but I know it's from God, I remember that I can do what I have to do.
What's your favorite book?
I am such an avid reader that I read so many books and I go, oh, that was a really good book. And I read a lot of Christian books and find them extremely valuable. So it's hard for me to even pinpoint this author or that person in particular, because I take so much away from everything I read.
What's your advice for our listeners?
Is to remind myself to slow down and listen, because I tend to be a very fast talker and to jump in, and my brain goes so fast that I have to remind myself to just slow down and listen to what the person is saying so that then they can feel that I listen to them.
We are down to the end of our show here. Share with us some parting wisdom and the best way to contact you.
Okay, so I guess my best parting wisdom would be to not be afraid to admit when you do need some help getting through something, because we isolate ourselves. We do it to ourselves more than anything else. So to not be afraid to say, I need help. I will say that sometimes people won't give it, but to just keep trying, because it's okay to need help. And to contact me, our telephone number here is 719-231-7183. And I do phone consultations, especially with birth stuff, because I'm one of the few people who can do that. And then my website is dunamascenter.com. That's DUNAMAS center.com.
Okay, thank you very much for joining us today, Pauline.
You're welcome. Thank you.
Thank you for joining us today on Relationship Helpers. It is our hope that you gained some valuable information. For the show notes and more information on today's topic, please visit www.relationshiphelpers.net. Again, that is www.relationshiphelpers.net. If you enjoyed our show, please go to iTunes to subscribe, rate, and review. If you had questions or concerns about our show, please let us know about this as well by going to our website, www.relationshiphelpers.net. Thanks again and have a blessed week. Note that accuracy and authority in regards to the subject matter covered today is not a replacement for professional care. Neither the host, the clinicians, or the guests are rendering clinical or other professional advice. Seek professional help if you need it.